Hello and welcome back to the Digital Health and Wearables series. Today I have another magnificent episode for you, but before I go ahead, let me remind you to subscribe to the channel and also check all the previous content, amazing guests there and a lot of content to digest. And also let me acknowledge our digital health platform, Clinitouch V, and our series partner, Fujifilm Healthcare. And today it gives me great pleasure to introduce you to Jamey Edwards. He's the Chief Operating Officer at Startup Health. Jamey, how are you?
I'm great, Joe. How are you? It's great to see you, man.
Yeah, great to connect. We were talking before the recording that you're one of these people, Jamey, that I feel like I know very well for a long period of time. And we,
Right.
we have we haven't met yet. We're just talking about IMS and other events, right?
Yeah, I really well look. I look forward to the day where you and I can share a coffee or a drink or something like that and meet in person.
Yeah, me too. I'm very fond of you because you gave me my first pair of pink socks many,
Ah,
many years ago. You're a very kind person. You sent me a pair of pink socks to UK. So thank you so much for that.
that was my pleasure. That was my pleasure. I owe that all to Nick Atkins, who gave me my first pair. So I'm happy to be able to pay it forward.
Yeah, thank you, Jamie. And today we are here to discussing humanizing healthcare. And the first question that I have for you is why is humanizing healthcare so important? And how did it become important to you?
Yeah, it's a great question, Joe. The healthcare system is about people, right? And in my first job in healthcare, I cut my teeth on the provider side, and I saw firsthand how the healthcare system was exhausting clinical teams despite what were our best efforts to combat it. And I think most people don't realize that doctors and nurses were really one of the leading workforces in terms of suffering from burnout. The number one system of that burnout is treating a patient like an object instead of like a person. And I have to say, on the flip side of that, patients really treat their doctors, especially insured patients, like a consumable resource they're entitled to instead of a trusted part of the care team. And I believe that while everyone is a patient at some point, not everyone sits on in the doctor's shoes and really can share that perspective. And we need to remember that doctors and nurses are people too. So establishing the fact that we're all humans as part of this ecosystem, I've really committed the last 15 years of my life to founding and leading companies whose express goal, right, was to humanize healthcare so that no patient was ever treated like a statistic and that we could really build connection between doctors and patients so they could engage with each other on a very human level instead of a transactional one.
Yeah, fantastic. Jamie, thank you so much for that insight. I mean, life is about people, but certainly healthcare is certainly about people in all domains, from the receiver, the treatment, the doctors, the clinicians, is all about people. So thank you so much for that amazing insight. The second question that I have for you is, can technology be used to humanize healthcare? If so, how?
Yeah, you know what? That question presents like this paradox. If we're including technology, how does that make healthcare more human? But the answer to that question is absolutely. At both Emergent Medical Associates and Cloudbreak, we use technology to bring patients and providers together to build relationships. And at EMA, which was our ER hospice anesthesia group, that was my first healthcare company that I led, it was really about properly training and supporting our clinical teams, building out a great data platform so that we could use that data to analyze practice patterns, track the patient, tracking patient and provider satisfaction, and more. Medicine, interesting thing about medicine, right? It's constantly asking doctors to do more with less, see more patients, be faster, be more efficient. So we focused on, instead of that efficiency, which was what we call table stakes in the industry, it was really about improving bedside manner, supporting doctors during their toughest clinical decisions, helping them build a sustainable lifestyle, which, for ER medicine is a real challenge. So these included putting technological advances like telemedicine in the field, which allowed them to practice from anywhere, but also brought specialty services to their fingertips while they were on site in the emergency department. So things like telestroke and telepsychiatry, which really help them feel like a broader part of a clinical team. All of these things de facto created a better patient experience, because if we're restoring the joy of calling back to our doctors, they will take better care of their patients, and made us the hospital of choice for patients at the sites where we practiced. At Cloudbreak, it was about something as fundamental as communication, something that we really take for granted on a daily basis. So make no mistake, clinical medicine is really communication driven. Like, we're used to getting poked with needles and having tests taken and doing all those different types of things. But when we look at a patient chart, all the boxes on that chart are about what's the patient family history, what's the history of present illness. These boxes and others provide the context around the clinical tests that inform and drive what's a proper differential diagnosis. So what happens when communication isn't present? Well, there's a spike in defensive medicine costs. There's an anxiety-prone clinical encounter for both the patient and the provider, and then terrible inefficiency. So who suffers from these health disparities the most? Well, it's our limited English proficient and deaf and hard of hearing patient population. So when we founded Cloudbreak, it was really on this mission to humanize healthcare every day by helping break down these communication barriers between patients and their clinical teams, but to do so in hospital by bringing language interpreters to the point of care and having them available on our platform in seconds. And so you can imagine, João, being in a hospital post an accident, you don't speak the language, people are running around you, poking you with needles, and you can't understand what's happening to you. So we committed ourselves to helping people at the scariest time of their lives and empower patients to engage in their care and doctors to make the right diagnosis during their toughest cases. We realized after building out 2,000 hospitals and what was many, many years of hard work, that we could expand our platform to include telestroke, telepsychiatry, teleurology, which really help clinical teams stay connected to patients, reduce the risk of infection, and reduce the use of PP&E, which was scarce at the height of the pandemic. So yes, technology can absolutely help patients and providers connect and humanize healthcare.
Brilliant. Thank you so much for that amazing overview, Jamey, about slotting in different elements and aspects of the technology per se, but also your great work, and also you have this mission, you are driven, but also you are successful because you managed to do that effectively. And bringing back to communication, effective communication is one of the, it seems very simple, but is one of the most important aspects, as you described. Thank you so much. And the third and last question, Jamey, that I have for you is, how are you still living this mission that you described, and in your new role at Startup Health?
Well, I mean, João, at my core, I am a social impact entrepreneur. And when I really thought about what I wanted my next chapter to be, it was really about helping other people like me achieve their missions. And Cloudbreak was a startup health company, so I was very familiar with the startup health team. And startup health is one of the leading healthcare innovation ecosystems in the world. They've invested in over 400 companies to date. And my role, and what I was hired to do, was to take this platform that was created by entrepreneurs for entrepreneurs with the express mission of solving the world's greatest healthcare challenges. We call those moonshots at Startup Health, and scale it. So all of our health transformers, which is what we call our entrepreneurs, are mission-driven founders who are starting with the best of intentions to build solutions that can really move the needle in creating the next generation of healthcare solutions that can drive a real impact. And we think about these people who are starting these companies, and most people found a company, João, because they saw a problem that either they experienced or someone close to them experienced, and they saw a need to address it. And the result of them addressing it is that impact. So our goal is to help them realize and their missions, and not only get them to their mission, but like mission to mission accomplished, right? By being there for them and supporting them on what is a very difficult journey of not just building a company, but doing so in healthcare, which can be really, really challenging due to the regulations, risk-averse cultures, the entrenchment of existing solutions. So what we do is we've put this into a platform, and we call it our Level Up platform. And the whole goal of that platform is to ensure that our health transformers are always striving to move their business forward and increase that impact. So how do we do it? We do it by providing amazing peer support and coaching through a program that we have called Circles. We amplify their messages via this media engine we've created called the Startup Health Media House. We provide toolkits that they can use very tactically in their business, as well as mindset tools, because one of the most important things that you have as your entrepreneur is your mindset. And that mindset is your ability or your belief you can actually solve the healthcare challenges that you're targeting solving. We have educational programs through fireside chats with industry leaders. It all culminates in the Startup Health Festival, which is currently going on in concert with Vive, which is one of the largest gatherings of healthcare innovators currently in the world. And it's this holistic approach, which is one of the most unique in the industry, that helps our portfolio companies create value. And not just create value once. We don't just put them through a class or a 12-week cycle. We do this throughout each stage of their development, and we partner with them for the long term. And that includes access to our very large investor and industry networks. And what it's really about is putting them in the driver's seat of this journey and giving this entrepreneur more control over achieving their mission and moonshot, because there's a lot of times where we as entrepreneurs don't have that control. And so being able to empower the entrepreneur when they're making the most important decisions about their company is a key thing that we do. And we know that that helps them build a better company. And we know that in our portfolio, the companies in that portfolio are really in the business of changing the world for the better. So I got incredibly lucky to find this role where I can combine the best of my experience with the chance to increase my own impact as a social impact entrepreneur at scale.
Fantastic. I mean, Jamey, you very successful with Cloudbreak, and you have your experience as you described. And correct me if I'm wrong, but when Startup Health started, was a bit of an event, bringing people together, and you guys really evolved and created a big community, bringing a lot of value. But also, what you describe is really magnificent and very unique. You tweak it and found out where you can add a lot of value with the mindset, the coaching, and the platform. Now you have so many elements. You also understand the industry inside out. And yeah, it's truly amazing. I've been following startup. I've been in a space for quite some time. I see things.
Yeah, I know. Very experienced, João.
I see things evolving. So, and I really saw Startup Health evolving too. It's fantastic. And you guys doing magnificent work, and you're pushing others to do it to create impact. And this is exactly what you described. It's amazing.
Yeah,
Right.
you know what, João? It's one of these things where I stood on the shoulders of other people to help build my career, and I want people to now stand on mine and help them build theirs. And if I can do that and have this amazing impact on a global basis with the rest of the team at Startup Health, like that's a really exciting opportunity, and that's what we're focused on over the next few years.
Yeah, Jamey, I want to thank you for accepting the invite, for your magnificent work, your kindness, your expertise, everything else. I could talk for you for a couple of hours, but
I
we
feel
can.
like we could too.
Yeah, we came to the end of the show. I don't know if you've seen the other episodes, but I finish all my recordings in a peculiar way. It's not really a question as such. Content is called 1 minute of fame, where over to you. You can mention anything. Startup Health, other innovators, your great work, personal achievements, professional, anything over to you to round up. 1 minute of fame.
Well, I mean, for me, I try and actually shy away from the fame, Joao. So, this like asking me for that makes me uncomfortable, but I'll lean in on it for a quick second and just say, I am a big believer in what people can do together. And what I would encourage us all to do is to think about how we can collaborate, how we can work together to help solve these issues. And you take a look at healthcare, Joao, and it's very siloed. Clinical teams don't speak to administrative teams. And then you've got payers and pharma and health systems, and not all are working together like we could. And I think it's pretty incredible when we all locked arms as one human race to solve what was something we couldn't even see, a microbe that was affecting all of us so greatly. And that gave me a lot of encouragement. We're living in a very tumultuous world right now. Obviously, we're seeing what's happening in the Ukraine. And my heart goes out to the people of the Ukraine right now, and I wish them great success in defending their liberties. It's incredible, though, to think about what we could do if we all pulled together to help solve issues like those. So that's what I would say. It's about kindness. It's about all of us working together and all being part of the same tribe.
Brilliant. What a great message to round up, to ask people to collaborate and ally forces and push forward together. Jamey, thank you so much for being in here and for being like a remote friend for a couple of years, and thank you so much for this amazing content, and I wish you all the best.
Well, Joao, thank you for this opportunity. I love engaging in these discussions because this is how we can help collaborate and get the message out that healthcare needs change, and people like you and me and everybody else are helping making it happen. So thank you for this opportunity.
Brilliant. Thank you, Jamie. I'm going to round up now. So, to our viewers and listeners, make sure you subscribe to the channel so you don't miss any of the great content. Also, let me acknowledge our digital health platform, CliniTouch V, and our series partner, Fujifilm Healthcare. Also, I'm going to post in here the links to connect with Jamie on LinkedIn or on Twitter. He's very active. Also, he's got tons of experience in healthcare. Reach out to him, ask him questions. He's a true collaborator and a very kind person. So I'll see you all next week.